Medical marijuana could one day be prescribed for anorexia, post-traumatic stress disorder, and irritable bowel syndrome. As Tisha Lewis explains, those are just a few of the medical conditions on a new list the Illinois Medical Cannabis Advisory Board is reviewing.
Well, Jeff, the board received nearly 24 petitions requesting 14 medical conditions be added to that list. It would allow more patients to seek treatment using medical marijuana. 27-year-old Feliza Castro suffers from anxiety. It's one of more than a dozen medical conditions the state is considering adding to its compassionate use of medical cannabis pilot program.
I did attend the Medical Cannabis Advisory Board meeting last week, and I asked them firsthand, how long is it going to be until realistically we see conditions added to the law? And they said about 12 months.
Chronic post-operative pain, diabetes, and even a migraine are on the list. Castro says it's all long overdue and describes her 2009 diagnosis with lupus and how traditional medication made her sick. So she turned to medical marijuana.
It was actually a total game changer for me all the way around. All of a sudden, that hopelessness that I had was lifted because of medical cannabis, and I've been able to live a really normal and really happy life because of it.
At the time, Castro lived in Michigan.
I became one of the first registered patients there.
Now, she's on the front lines of the movement to legalize medical marijuana in Illinois. Dr. Jonathan Spiro says it's an uphill battle.
Because most doctors are not comfortable certifying patients, even if they have a qualifying condition.
Even so, for Feliza Castro, it's worth the fight. And she says the state's Monday morning announcement to consider adding medical conditions to its medical cannabis pilot program is proof.
Now that they've set a hearing date for May 4th, now we know that our petitions are getting somewhere.
The state's Medical Cannabis Advisory Board will hold that hearing at the James R. Thompson Center again on May 4th. A political analyst I spoke with says there are several lawsuits that need to be resolved before the program can gain momentum. The big question tonight, Jeff, can the state establish precedent to use medical marijuana for pain, which would open it up to thousands of people?
Still a lot of questions surrounding this story. Tisha Lewis reporting. Tisha, thank you very much.